Did you know that 41% of postmenopausal women who are over 60 and haven't had a hysterectomy yet are likely to experience a pelvic organ prolapse? That's insane. Prolapses are much more common than people realize, and a lot of people don't even know what a prolapse is. A prolapse occurs when the pelvic floor muscles aren't strong enough to support the organs that are housed in the pelvis. This can happen in males and females, and it can happen in the young and old. If you have a prolapse, some of the symptoms you may experience include low back pain, a heavy, aching, or full feeling in the pelvis, leaking urine when you cough or sneeze, constipation, difficulty inserting a tampon, and having to push or strain when you need to urinate. Okay, so here we have some diagrams of the different types of prolapses that can happen. This is actually what a normal pelvis should look like when you have a uterus. Okay, so there's a bladder, uterus, vagina, and the rectum all right there. Okay, and then here you can see that the bladder is collapsing into or prolapsing into the vagina. Okay, and the rectum is, it looks like a little bit here too, but here is actually where the rectum is prolapsing into the vagina. Okay, and here you'd feel like you have to poop and you would go, but then you'd feel like you still have more to go. And that's because it's getting stuck in this section here. And then same for the bladder. You notice how this section is actually below the urethra. And that's because, you'll empty, but then there's still going to be some urine left in there. And so you're probably going to feel like you still have to pee, even though like it can't get out. And then here, the uterus is prolapsing down into the vagina. And then here is where a hysterectomy has happened. So actually, this would be normal for what a hysterectomy patient would look like. And then, but sometimes you can prolapse just kind of what's that space there. It just prolapses down into the vagina there. So a prolapse is still possible if you have had your uterus removed.